Hey everybody, Jasmine here to talk about Madeleine Leininger's theory of culture care, also known as the theory of culture care, diversity, and universality. Here's just a brief overview of what we'll be talking about today, and let's go ahead and dive into the theorist herself. So, Madeleine Leininger was one of the most widely recognized nursing theorists, educators, researchers, and public speakers. She's most well known as the pioneer of nurse anthropology and the founder of transcultural nursing. Her theory is now a nursing discipline and it's an integral part of healthcare today. She was a prolific writer and public speaker. But what I find most inspiring about her is her incredible dedication to understanding the intersection of culture and nursing. She really dedicated her life to studying different aspects of cultural care, and it took her all over the world. That we know of, she traveled to at least a dozen countries to study cultures worldwide, and she's pictured here among the Gadsup tribe of New Guinea when she was doing research there in 1992. In 1998, just a few years before she passed away, she was recognized as a living legend by the American Academy of Nursing. So, milestones of her life and her theory. She was born in Nebraska in 1925 to a German father and Irish mother, so right off the bat there, she was already blended in terms of cultural differences and had some awareness. Um, she credits caring for her aunt, who suffered from a congenital heart disease, for inspiring her interest in nursing. She went to nursing school in 1945. She went on to get her BSN and master's in psychiatric mental health and psychology. And then in 1965, her academic path took an unusual turn. This is really kind of what set her apart as a nursing theorist. She went on and got her PhD in social and cultural anthropology at the University of Washington. In fact, she became the first nurse to hold a PhD in anthropology and nursing. So, you may ask, why get a doctorate in cultural anthropology as a nurse? It's definitely not the typical academic route for nurses. And in a minute here, I'll get into more of her story there. A little bit more in terms of her theory. She founded the transcultural nursing discipline in 1974. It became a formal concept and field of study, really blending the concepts of nursing and anthropology in terms of theory and practice, and it was formally integrated into nursing curricula in the 70s. Then in 1985, she published her Transcultural Nursing Concepts, Theories, Research, and Practice, and then in 1991, she published her Theory of Culture, Care, Diversity, and Universality, and that's what we'll be talking about more today. So, as promised, why she went on to study anthropology. So, shortly after graduating nursing school in the 1950s, Leininger was working as a clinical nurse specialist in child psychiatry, where she was working at a children's guidance home. She noticed recurrent behavioral differences among the children, and she hypothesized that maybe there was a cultural base. She was seeing a lot of different cultural expectations from parents, and it really sparked a spirit of inquiry in her, where she started to look more closely at culture and healthcare and how one size really doesn't fit all and how one approach might work better for one patient than another. She also saw how cultural differences can lead to a distrust of the healthcare system, as well as opportunities for misinformation, misinterpretation, and where that breaks down communication and treatment and ultimately patient outcomes. And this was around the years following World War II, where we saw a lot of immigrants from many different backgrounds and cultures coming to America, and everything was just becoming more culturally diverse, and she recognized that nurses needed to acquire a broader knowledge base in order to be able to provide care to these people from such different cultural backgrounds. Today, the U.S. has one of the most culturally diverse populations. So, all of these experiences led her to look at a blending of nursing with anthropology, and that's where her theory came from. It was really groundbreaking. It was a really a new perspective in terms of how to care for the individual, not just in terms of their symptoms and disease, but also in terms of knowing about their cultural background and their values and the patterns within that. This is a quote from her. Nurses today realize that in the future we will be caring for more and more diverse population of patients as the world becomes increasingly multicultural. She said that over 20 years ago, and we know that that's just even more true today. And it's very in line with the Christian worldview. 1 Corinthians 14:10 says, "There are doubtless many different languages in the world, and none is without meaning." The Bible really teaches us that all men and women were created in the likeness of God, and that as such, every human being deserves to be treated with dignity and respect. And that's really the framework of Leininger's model. So here's the meta paradigm. I'll let you read through that because it's a little bit dense, but essentially describes the importance of nursing as a career science, focusing beyond the traditional nurse-patient interactions, but engaging a larger worldview that looks at families and communities and culture. This is her definition of culture: learned, shared, and transmitted values, beliefs, norms, and life ways of a specific individual or group that guide their way of thinking and their decision making. These are the key assumptions of her theory. In essence, there are quite a few more. These are just a few that I picked out. But in essence, they are that care is essential for growth, development, and survival. Without care, there's no chance of cure. That nursing is in itself transcultural, and that every culture has generic caring modes, behaviors, and beliefs that are indigenous within its own culture, and that there are culturally universal elements of care everywhere. So, cultural competence was actually a phrase coined by Leininger. It's now well-accepted terminology. She described culturally competent care or congruent care as care that fits or is sensitive to the culture. She described it as a constant learning process, an exchange of respect and willingness to learn. She said it's all about trying to understand and respect the values, choices, and beliefs of others. She also recommended trying to maintain a spirit of inquiry and a spirit of respect in all of this so that it can be approached as a learning experience rather than an inconvenience. And as we all know, cultural competence has been shown to increase patient satisfaction, patient outcomes, and then decrease bioethical conflicts. Here is her Sunrise Enabler. This was a method that she built to assess culture and healthcare determinants. These are the three modalities of care that Leininger recommended. They form the framework for her theory. The first is cultural preservation and maintenance. She said, preserve what functions well, that which is acceptable and what's congruent. But if it's not acceptable, you may need to move on to accommodation or negotiation, in which there's looking into what can be adapted in order to provide safe and effective care. And then the last one is cultural restructuring, helping people reorder, change, or modify their life ways for the better. This is the nurse-client relationship. Essentially what we're focusing on here is the co-participation of the nurse and the client working together to identify, plan, and implement a culturally sensitive approach. Here's the significance for FNPs and really nursing in general. First off, globalization. Leininger identified a shift from uniculturalism to multiculturalism. We know that the world is changing, there's increased migration, and the framework has to change accordingly. Transcultural nursing is crucial as societies shift to a more culturally diverse population. The second is recognizing the cultural stress for patients and their families due to cultural misunderstandings. I'm sure we've all had one experience with a patient of a different culture background that experienced some misunderstanding or misinterpretation and possibly different care because of that cultural stress. The third is the stress on our end for nurses. Leininger proposed that her theory helps reduce nurse burnout, culture shock, marked ethnocentrism, and many other conditions in practice. Here's the application questions and my references.